Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about Achilles tendon pain. So let me remind you kind of where that is. Most people know where the Achilles tendon is, but I want to show you the anatomy anyway. So you've got the heel bone or the calcaneus, the Achilles tendon attaches in the back. It's the strongest tendon in the body. It's pulling on that heel. It helps you to walk. It helps you to maneuver, dance, whatever you're trying to do. But when it's not doing what it's supposed to, then it can actually get sore. You can actually get Achilles tendon pain. And there's several reasons why you could get Achilles tendon pain. One would be just a tendonitis or a tendinosis, they call it when it becomes chronic. It can be a strain or a tear. It can be a rupture. And the question is, what's the difference? So we're going to start with tendonitis. What is tendonitis? So when it comes to a tendon anywhere in the body, you can actually get tendonitis, which is an inflammation of the tendon. A lot of times that comes without injury. You're just overworking the tendon. The tendon itself swells around it. And this swelling around that tendon causes pretty significant pain. It causes pain with motion. It causes a lot of times will limit your ability to continue to move, continue to do what you're doing, and it can be really problematic. That usually means people end up going in and seeing the doctor because they're saying, okay, it hurts to walk. It hurts to do things. I can't climb the stairs like I used to. I can't run or play with my kids or whatever it is that you like to do. You can't do it because of this inflammation, this Achilles tendon pain. And really, it comes down to what can you do for it. And with any type of injury, there's really four things you can do. And I'm going to go into more depth on conservative treatments for the Achilles tendon. But when you've got an injury, there's four things really that you'll do. One is you're going to rest it. So if you can limit the motion of it, that's going to help. Sometimes you'll be put into a boot. Sometimes you put into a heel lift, something like that, to reduce the motion of that tendon to allow it to rest. If you can sit down and not do anything, that's another way to rest it, right? Ice. So anytime it starts to get inflamed, if you ice that area, it's going to decrease the inflammation. So rest, ice, compression. The reason you get a tendonitis is because it swells. And so if you can actually put pressure on that, it actually kind of pushes the swelling out. And that's the goal of compression and elevation. As you elevate it, gravity is going to work for you instead of against you, and it's going to actually help get that swelling out. So rest, ice, compression, elevation, rice. The idea is with each of those things, you can actually conservatively treat an Achilles tendonitis or other types of injuries in the meantime. So we're going to go into more depth. There's some other things you can do, including MLS laser, including different type of mobilizations, those kind of things that you can actually do for an Achilles tendonitis. But just so you know, if you've got pretty significant pain, there is a possibility that all it is tendonitis, and there are things that you can do to completely resolve it. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 236, Achilles pain from Achilles.